If you've ever tried to get help from the VA, you already know, there's a problem, a big one. Maybe you waited months for a medical appointment, only to be told they lost your paperwork. Or you've spent hours on hold just trying to talk to someone, anyone who could help. For some veterans, these problems are just an inconvenience. For others, they're life-altering, missed care, delayed benefits, worsening conditions. And while the VA was created to serve veterans, for far too many, it's doing the opposite. For too many American heroes, trying to get help from the VA feels like returning to the battlefield. So what's the biggest problem with the VA? What's causing all this frustration and harm? And, most importantly, how can we fix it? Today, we're going to break it all down. We'll talk about where the VA is failing, why it's gotten so bad, and what real solutions could look like, because you've served this country, and you deserve better. Let's get into it. So what is the VA's biggest problem? It's timely access to care, or, more accurately, the lack of it. For veterans across the country, getting the care they've earned can feel like an impossible task. Long wait times, lost paperwork, and endless delays are putting veterans' health, and sometimes their lives, at risk. According to the Government Accountability Office, GAO, the VA serves over 9 million veterans annually, and yet the system is buckling under the pressure. The VA's claims backlog, veterans waiting for disability benefits, has now surpassed 234,000 cases, the highest it's been since 2014. And that's after hiring over 61,000 new employees in 2023, its largest expansion in 15 years. Despite this, facilities remain overwhelmed and veterans are left waiting in line for care they've already earned. But it's not just claims. Even getting an appointment can be a battle. Veterans needing urgent care are often waiting months for their first visit, and in the meantime, their health worsens. The consequences are devastating. Delays in care mean worsening conditions, missed treatments, and in the worst cases, veterans dying before they ever get the help they need. The VA was built to take care of those who served, but for far too many veterans, it's failing at the one job it was created to do. Veterans shouldn't have to fight for the care they earned. So, why is the VA failing to provide the timely care veterans deserve? The truth is, it's a combination of factors, but they all point to a system that's overwhelmed, outdated, and tangled in red tape. Let's start with outdated technology. The VA has been trying to modernize its systems for years, but instead of fixing the problems, it's created new ones. Take the electronic health record system, a multi-billion-dollar project that was supposed to streamline care. Instead, it's been plagued with glitches. In 2022, over 41,000 veterans were warned their care would be delayed because of issues with the system. Imagine needing urgent medical attention and being told, sorry, the computers aren't working. And it's not just the record system. The VA's technology is stuck in the past, with scheduling systems and claims processing tools that can't handle the demand. These failures lead directly to delays that veterans simply can't afford. Then, there's the bureaucracy. Veterans trying to get care or benefits often find themselves navigating a maze of paperwork, approvals, and follow-ups. And when something goes wrong, like the system glitches in 2023 that delayed claims for 32,000 veterans, it can take months or even years to get things back on track. It's frustrating, it's inefficient, and it's completely unacceptable. Even with a record 61,000 new hires in 2023, the VA still doesn't have the staff it needs to keep up. The VA serves over 9 million veterans annually, yet they have less than 1,500 healthcare facilities. Doctors, nurses, and administrators are stretched thin, and that strain leads to longer wait times and more frustrated veterans. And the demand isn't slowing down. Today's veterans are coming forward with increasingly complex health needs, mental health challenges, chronic illnesses, and injuries from decades of service. The system wasn't built to handle this level of demand, and it's cracked under the pressure. When you put it all together, outdated technology, bureaucratic inefficiencies, staffing shortages, and rising demand, it's no surprise the VA is struggling. But just because it's not surprising doesn't mean it's acceptable. There shouldn't be obstacles standing between veterans and the care they need. Comment down below if you agree. So, how do we fix it? How do we take a system that's overwhelmed, outdated, and inefficient, and make it work for the veterans who depend on it? The solution might seem radical, but it's also simple. Decentralize and integrate. What does that mean? It means breaking down the VA's massive bureaucracy into smaller, more agile units, and integrating VA services with private healthcare networks in a way that works for veterans, not against them. Step 1. Decentralize the VA. The VA is currently a massive centralized system that tries to serve over 9 million veterans with a one-size-fits-all approach. But veterans' needs aren't one-size-fits-all. A veteran in rural Montana faces completely different challenges than one in New York City. By decentralizing, we'd empower regional VA hubs to make decisions locally, tailored to the unique needs of their communities. These hubs could handle everything from staffing to scheduling, cutting through the layers of approval that slow everything down. This isn't about shrinking the VA, it's about giving it the flexibility to respond faster and smarter. Step 2. Seamlessly integrate with private healthcare. Instead of forcing veterans to rely solely on VA facilities, we integrate their care with private hospitals and clinics, without the red tape. Right now, veterans can use the Veterans Community Care Program, but the process is overly complicated. Veterans have to meet specific eligibility requirements and often wait for VA approval before they can even book an appointment. The solution? A universal VA card that works like private insurance. Veterans could walk into any accredited healthcare facility, swipe their VA card, and get treated. No pre-approvals, no delays. The VA would handle payments and oversight behind the scenes, ensuring that standards of care are met. Step 3. Adopt tech-forward solutions. Fixing the VA's outdated technology is critical, but let's go a step further. Imagine using AI-powered systems to predict care needs and schedule appointments automatically. Or creating a unified digital health record that follows veterans wherever they go, whether it's a VA hospital or a private clinic. This kind of innovation would eliminate the bottlenecks caused by lost paperwork and outdated systems. The technology exists and no one deserves it more than the veterans who fought for the freedoms we all have. By making real changes, we can see real results. This wouldn't be just a tweak to the system, it's a transformation. By decentralizing decision-making, veterans won't be stuck in a national backlog. By integrating care, they'll have access to treatment when and where they need it. And by embracing technology, we can eliminate the inefficiencies that have plagued the VA for decades. Veterans deserve a system that works for them, not against them. It's time to stop patching up the VA's problems and start rebuilding it into something that truly serves those who've served. Reforming the VA is about fulfilling a promise made to the men and women who served this country, a promise that they'll be cared for when they need it most. For too long, America has broken this promise. Instead of helping veterans, we've forced them to sacrifice more time, more energy, and in some cases their health, just to get the benefits they've already earned. Delays in care, lost claims, and endless red tape have turned what should be a lifeline into yet another battle. But it doesn't have to stay this way. By decentralizing the VA, integrating care with private networks, and modernizing its technology, we're not just fixing the system, we're reimagining it. We're creating a VA that doesn't just work, but works for veterans. And the best part? These changes are doable. They're not pipe dreams, they're practical, scalable solutions that can start making a difference right now. Imagine this. A veteran in a small rural town doesn't have to drive hours to a VA facility anymore. They can walk into their local clinic, use their universal VA card, and get treated that day. A veteran applying for benefits doesn't have to worry about their claim disappearing into a black hole of bureaucracy. With streamlined tech and localized decision-making, those benefits are processed faster, with fewer errors. The VA was built to serve veterans. It's time we make that mission a reality again. Veterans served this country with honor, courage, and sacrifice. It's time for this country to serve them with the same commitment. Reforming the VA isn't just an idea, it's a necessity. Because every delay, every glitch, every misstep isn't just a failure of a system, it's a failure to honor the people who put their lives on the line for us. The solutions are there. Decentralize, integrate, modernize. These changes can rebuild a system that veterans can rely on, a system that doesn't make them fight another battle just to get the care and benefits they deserve. But real change starts with us. Your voice matters. If you face challenges with the VA, share your story. If you believe in this mission, spread the word. The more people who demand accountability and reform, the closer we'll get to a VA that truly works. If you found this video meaningful, like share, and subscribe to help us reach more veterans and advocates who care about this issue. Together, we can make the change that veterans need and deserve. And don't forget to leave a comment telling us how you would fix the VA